Hello, everyone. Welcome to this ePoster presentation, which is a part of the Faculty of Clinical Informatics Conference 2023. I'll be discussing the importance of electronic patient records on the impact of the COVID-19 pandemic in the ICU. The scoping review showed that most electronic records used in the ICUs were either commercial off-the-shelf or custom built in-house. Some of them had their data stored on site, while a few of them had the data in cloud, and some had their data on dedicated hosted servers. A few of them were standalone, or some of them had their data integrated into clinical decision support systems or electronic patient prescription management system, and some of them had their system integrated into both. So EPRs generally are digital repositories of patient health information that have engendered a paradigm shift in ICU management by seamlessly integrating diverse data streams. The aim of this study was to determine the impact of transition to a new EPR technology intensive care units during the pandemic. And the objectives and methodologies of this research are as follows. So in terms of the objectives, it was to identify the user groups that have used the EPR within the ICU and how they've used it, then determine the change in the frequency of utilization of EPR before and during the COVID-19 pandemic. Then thirdly, to evaluate how the move to a standalone EPR system impacted the ability to monitor COVID-19 and for whom has this impact occurred. So the study design was actually a methodology called realist evaluation, but I've got the qualitative aspect of the research, which is a group series of observations, interviews, and document analysis, and then the quantitative part where I'll be conducting an integrated time series analysis of data from the EPR system. So as I said, with the methodology, it's a realist evaluation. So I'll be looking at what has worked and whom has it worked for and in what circumstances. So the context, I'll be looking at context to say EPR use in the ICU for nursings. And then in terms of their processes, for example, I might be looking at how they've used it to monitor lines and tubes. So in terms of drips and fluid intakes of the patient, and then following my data analysis, I'll be checking that and collaborating it quantitatively with the data in the EPR system. So from the literature review, before the literature review, a scoping review, which followed the scoping review, there was discussion with stakeholders, key stakeholders within the ICU in different trusts. So I talked to chief nursing officers, chief physicians, and senior physiotherapists in 7 different trusts, and that was what drove the questions for the literature search. So we found out that literature around the use of EPR in ICU during COVID actually occurred 22 times, and it was mostly common in the US where there were 12 of such research. Then UK came a distant second with 3 of such research, and then we had the Netherlands with 2 of such research. In Australia, India, Iran, Saudi Arabia, and Switzerland, there was 1 of such studies each. If you want to have an idea or a link to the references mentioned, kindly scan the QR code provided on this screen. At the end of this study and the end of the scoping review, like I said, interviews with stakeholders and then the literature review, the impact, the significance or the importance of EPRs in the ICU could be categorized into 5, and one of such is the data accessibility and continuity. It was also discovered that it was used for resources optimization and efficiency. So it was used for workflow, staff allocation, and things around managing teamwork. Then it was used for data analytics and decision making for the in-house patients. And it was also possible for remote monitoring and collaboration. So doctors or physicians or any of the allied health workers could log in remotely via phone, via web page, and have a real life look into what was going on in the ICU. And we find out that the EPRs in the ICU have actually helped in terms of research and public health surveillance. So we're able to in-house know if a patient is deteriorating, and we are able to as well know if there are major changes in the pattern. In summary, we found out that the most common type of EPRs that are being used in the are Epic, Senna Millennium, Scripts, eClinicalWorks, NextGen, Meditech, Centricity, Practice Vision, MetaVision, and Netina Health. And the user categories cut across all doctors and allied health workers. So doctors, nurses, pharmacists, occupational therapists, dietitians, physiotherapists, radiographers, and speech and language therapists have all used EPR in the ICU. And EPR have been used for all patient levels. So from level 1 to level 4 care in the ICU have all been using EPRs, and it's been used throughout the patient journey, right from when they've been moved into admission. So either from the time they've come from the ward or they've come from the A&E, and during the time they've spent in the ICU and during their discharge. But like every system, the EPR tools have got their own demerits or weaknesses in terms of there have been issues around alerts. So some of the users have felt there have been too numerous alerts, and then there is the issue of training and software glitches. But because this is not the main issue of this research, there will be further research on that. Thank you.